Okay, so we've assessed the nose and the mouth, and the next part of this is going to be the neck. So first we're going to inspect the neck. We're going to inspect
Moving
the
down from
surface
the head and
color,
face, we're going to
the
be
lesions, and
assessing the
condition of the
neck.
neck. Make sure
We're going
that's
to first
symmetrical.
be
And then
inspecting the
we're going to
neck. We're looking
demonstrate the
for
motion.
skin,
So Professor Bird, I
symmetry,
just passed you
color,
focus. Go
lesions,
to the
and the
left.
position of the
So, and
neck.
then lift your chin
Here,
up.
Professor
And
Bird, I
then your
asked her to
pelvis.
do range of motion,
Lift your
so tuck
belly.
your chin,
There we go.
flex
And
your
then
neck,
turn to the right.
turn the
And then
head
turn
from
to the
side
left.
to side. And again,
Okay,
have your
perfect.
patient do this very slowly so they
You
don't
want
get
to do that
dizzy.
slowly, especially with maybe older patients that might have some dizziness
That's
issues.
assessing
You
for
want to take it
range of
slowly. You
motion
just
for
want
the
to see
neck.
what the range of motion is. And then you're going to assess another cranial nerve here. This is cranial nerve 11, the spinal accessory. This one,
I'm walking back here. I'm going to be checking for cranial nerve number 11, which is your spinal accessory.
so we can
And
check
just
for
put pressure on the
cranial
shoulders. Ask your patient to shrug their shoulders against resistance. They should be able to do that bilaterally with equal strength.
cranial nerve
And that
11.
would be intact for cranial nerve
Our
number 11,
accessory is
spinal
intact.
accessory.
So next you're going to palpate. After you've inspected, you're going to palpate. And here, you're palpating the trachea. So remember the
After
trachea is in
inspection,
your
you can
head.
start to
You want to
palpate.
make
I'm
sure that it's
palpating here the
midline. So you
trachea
don't
for
lean forward.
alignment, making sure it's midline, checking for
You just want to
moisture,
make sure it's
temperature,
midline. Obviously, if
tenderness.
it's deviating to any side, that is cause for
And I
concern.
was explaining here that tracheal
And then you're
deviation
going to
would be
kind
a
of
very
check the neck
concerning
for
finding.
moisture, tenderness,
But if you had
and
tracheal deviation, your
just want
patient
to
would
hear
be very hard of
the
breathing.
back of the throat.
Checking for temperature here, you want to check temperature with the
Moisture,
dorsal side of
no
your hand.
diaphoresis, so that's a normal finding. And then you're going to palpate the lymph nodes. So what I usually like to do
And
is
then next, I'm going to palpate the lymph nodes. And so I always start pre-auricular and kind of, you'll just see me softly work my way around to the post-auricular, down the cervical chain lymph nodes, to the supraclavicular. And you're just feeling those superficial lymph nodes there for any tenderness or puffiness.
palpating the tenderness. And if you want to finish, and you go to the supraclavicular.
You guys do not have to name these lymph nodes either. You can just say I'm palpating the lymph nodes and that'll be good.
Down as well, the post-cervical. And I didn't feel any puffiness. You didn't have any tenderness, so that's a normal finding. And then next we're going to palpate the carotid pulses. So these you don't want
And
to be
lastly, for
scared.
palpation, I'm getting
Other
ready
parts of the
to
pulses
assess
you
the
can see
carotid
here, like at the
pulses.
carotid, you
One
don't want to
important
see
thing
that
to note
carotid
with the
tip.
carotid
If we
pulses
cut
is
out
you
the
never want
circulation, then
to
it's really good for
palpate the
us.
carotid pulses
So
both at the same time.
here,
So you're just going to do one at a time. You're going to grade it. I graded these a 2 plus for Professor Bird, and then the other side.
and those are not bounding. Those are a 2 plus on that grade. And then we're gonna, after we palpate, we're gonna auscultate.
And then after you palpate, you can auscultate the carotid pulses. When you're auscultating any pulses for bruits or turbulence, you want to make sure you use the bell side of your
You want to
stethoscope.
use your bell because a bruit is a lower sound.
The bell side is used for hearing lower sounds.
Okay. And the bruits indicate turbulence, so that's not something you want to hear. But hers, I did not note any bruits.